Hello dear friends, this is a very rare case and I would like to discuss it with you. It is a male patient, 65-year-old, who presented with acute on chronic abdominal pain, shifting dullness, tachycardic, new oxygen requirement, ascitic fluid which was milky pink, and CT scan was done to rule out any underlying malignancy. So I would like to scroll the images first of all to have your first impression, and then we will discuss the findings. So let's start from the lung basis. And let's going down through the upper abdominal organs, the retroperitoneum, and let's go little down to the pelvis. Okay, so let's start from this finding here. This is the most impressive finding. As you can see here, there is an amorphous and diffusely infiltrating mass lesion in the retroperitoneum, particularly in the right perirenal region. In a lesser degree, there are some infiltrations on the left side. There are some infiltrations around the great vessels of the retroperitoneum in a significant degree. So, as you can see, the inferior vena cava is it's very difficult to be distinguished. At this level, part of the mass encases significantly the right ureter. There is significant stenosis at this point. However, there is no significant hydronephrosis. Another feature is that there is a significant ascites, free fluid in the abdomen, which is relatively hyperdense. It's not clear. There are also some infiltrations in the supradiaphragmatic region, like in this region here. These nodules here, I'm not sure, maybe either infiltrations or some supradiaphragmatic lymph nodes, reactive lymph nodes, but anyway, this represents another lesion, a mass, infiltrating mass. There is a consolidation in the right lung base, some free fluid, some pleuritic fluid on the right side, and probably in lesser degree on the left side. Small volume linear atelectasis in the lung basis, more prominent on the right side. Possible infiltrations in the lung parenchyma. There are also some infiltrations between the lower esophagus and the thoracic aorta in this region. And some infiltrations in the pericardium at this level. Although there is involvement of multiple regions, the retroperitoneum is affected mostly, as you can see. And in this interesting article, there is a table showing the categories and subcategories of retroperitoneal lesions, roughly neoplastic and non-neoplastic. Just take some time to read and to try to narrow down the differential diagnosis. Almost all the pathologies in this table do not absolutely match the findings of our case, apart from a few of them. For example, liposarcoma, MFH, leiomyosarcoma, neurogenic tumors, germ cell tumors, etc. But in my opinion, Erdheim Chester disease is highly suspicious. The second I'm thinking is lymphoma, but however, it's not absolutely typical. Maybe it's not typical at all in my opinion. So, Erdheim Chester disease is highly suspicious, and I would like to give you some information regarding this very rare disease. First of all, it's a multi-system non-Langerhans histiocytosis, seen mainly in adults and very rarely in children, may involve multiple organs, and in most of the cases involve the bones. In this case, there is no skeletal bone involvement. All the bones were normal. However, Erdheim Chester disease without skeletal involvement has been reported in the literature. It usually affects adults in the 5th to 7th decades of life and has non-specific clinical manifestations. The disease is confirmed only on histopathology. Despite the fact that the disease is a non-malignant entity, it might be fatal due to multiple organ dysfunction. It is very rare disease, and only 500 to 600 cases have only been reported in the literature. Particularly for this case, the main differential diagnosis includes the lymphoma, but in my opinion it's not absolutely typical. This case is not a confirmed case, however, it's very unusual and very rare, and your comments and your inputs will be very appreciated. Dear friends, thank you for watching this interesting video. See you again the next time soon.